Hey everyone, ready to dive into some seriously important stuff? We're talking stroke today. And get this, it's way more common than you might think. But the advancements in treatment, let's just say they're pretty amazing.
You're telling me this 2024 Lancet seminar you shared, it's packed with eye-opening research, diagnosis, treatment, even prevention. We're talking major breakthroughs.
Music to my ears. But before we get ahead of ourselves, let's back up a bit. For anyone who might not be familiar, what exactly is a stroke?
Well, in the simplest terms, it's like this. The blood supply to part of your brain gets disrupted.
Yeah.
And because of that, the brain tissue, it's starved of oxygen, essential nutrients. Imagine, like, cutting off the fuel supply to a vital engine.
And that's when things go haywire. Now, I know there are different types of stroke, right? Ischemic and hemorrhagic. What's the difference? And which one is, like, the one we should really be worried about?
Okay, so, good question. Ischemic strokes, way more common. It's all about a blood clot blocking an artery. Picture a traffic jam in your brain's blood flow, right? Hemorrhagic strokes, on the other hand, think of it like a burst pipe. A weakened blood vessel in the brain, it ruptures.
Okay, two different culprits, two very different brain emergencies, so to speak. Either way, it sounds terrifying, and the seminar definitely doesn't sugarcoat the impact, does it?
Not at all. We're talking a global health crisis here. Stroke, second leading cause of death worldwide, and the third leading cause of disability. In 2019 alone, 12 million new cases.
12 million. Wow, that's more people than the entire population of some countries. This isn't just some, like, rare disease, is it?
Nope, not even close. And the burden, it's not evenly distributed. Huge difference in stroke impact between high-income and low-income countries.
What contributes to that disparity? Is it simply a matter of access to healthcare, or is there more to it?
Oh, access is definitely a huge factor, both for prevention and treatment. High blood pressure, diabetes, smoking, these are all major risk factors. And they're more prevalent in low-income countries, often coupled with, well, limited resources to actually address them. It's complicated. Far-reaching consequences.
Okay, so we've established stroke's a big deal, affects people all over the world. Let's zoom in on the most common type ischemic stroke, because this Lancet seminar, it really dives deep into the nuances, right?
It does. And one of the key takeaways is this. Understanding the cause of an ischemic stroke, that's crucial. And that's where the TOAST classification system comes in.
Okay, toast. Like, you put in a toaster. I'm guessing that's not it. What is this system all about?
Haha, good one. Not quite, although I appreciate the analogy. Think of TOAST as like a detective tool for doctors. It classifies ischemic strokes into different subtypes based on the root cause, right?
Right.
Was it a clot from the heart, a blockage in a large artery, something else entirely? This identification, it's essential because it guides the most effective prevention strategies.
So it's like knowing the why helps prevent the, again, makes sense. Now, the seminar also talks about something called a transient ischemic attack, TIA. Most people probably just brush these off like mini strokes, but it sounds like that thinking is outdated.
100%. Thanks to advancements in neuroimaging, particularly diffusion-weighted MRI, we now know a TIA is essentially a minor ischemic stroke. There's actual damage to the brain, even if the symptoms are temporary.
Wow. So even a brief episode of stroke-like symptoms, that still warrants immediate medical attention. There's no such thing as a warning stroke to just, like, shrug off.
Exactly. That's
Yeah.
a major takeaway here. Any stroke symptoms, no matter how fleeting, they deserve immediate attention. It's your brain sending an SOS. Ignoring it, it has serious consequences. Yeah, no, you really don't want to mess with those warning signs.
Yeah.
We've talked a lot about ischemic stroke, but let's switch gears for a sec. Hemorrhagic stroke. Less common, yeah, but equally concerning, to say the least.
Right. That's the brain's version of a burst pipe, if I remember correctly. Definitely sounds scarier, to be honest. Is that how doctors usually describe it, by the
Yeah,
way?
it's a pretty vivid analogy, I'll give you
Right.
that. And yeah, somewhat accurate. Remember those weakened blood vessels we talked about?
Mhm.
In a hemorrhagic stroke, one of those vessels, it ruptures, bleeding within the brain. And yeah, often trickier to treat than an ischemic stroke.
Yeah, I can imagine. But isn't it easier to, like, diagnose? Since you're literally looking for bleeding.
You would think so, wouldn't you? And while it's often easier to, spot on a brain scan, the real challenge, figuring out why that vessel decided to rupture in the first place. High blood pressure, a pre-existing condition, something else entirely. Uncovering that root cause, it's just as crucial as stopping the bleed itself.
So just like with ischemic stroke, finding the why is important for both treatment and prevention. Got it. The seminar, it dives into some pretty complex subtypes of hemorrhagic stroke, particularly those related to small vessel disease. What exactly does that mean in this context?
Good question. Remember how we discussed small vessel disease with ischemic stroke? Well, it's a factor in hemorrhagic stroke too.
Mm,
Two big culprits, really.
yeah.
Deep perforating artery vasculopathy and cerebral amyloid angiopathy.
Okay, well, hold on a second. Those are some serious tongue twisters. And I'm guessing they're not just random medical jargon, right? What do they actually do?
You're right. They sound pretty intimidating, but understanding them is key. Imagine the walls of your blood vessels, right? Like delicate pipes. Now picture those pipes slowly weakening, becoming more fragile over time. That's basically what these conditions do. They compromise the integrity of those tiny vessels deep within the brain, makes them more likely to rupture.
So they're like setting the stage for a hemorrhagic stroke to happen.
Exactly. And just like with ischemic stroke, MRI, it's crucial for accurately diagnosing hemorrhagic stroke and for identifying whether it's linked to, small vessel disease or another underlying cause.
Makes sense. Identify the culprit, target the treatment. Speaking of treatment, this Lancet seminar, it really emphasizes acting quickly, especially for ischemic stroke.
Absolutely. Yeah. The faster you restore blood flow to the brain, the better the chances of recovery. Time is brain. It's not just a saying, it's a medical reality.
And the good news is, it seems like we've made some serious strides in acute stroke treatment. The seminar, it highlighted several groundbreaking advancements, especially for ischemic stroke.
We have. One of the most significant has been in pre-hospital management. Specifically, the development of mobile stroke units.
Mobile stroke units? Wait, are we talking like ambulances with like mini labs and brain surgeons in them?
Not quite brain surgeons, haha, but you're on the right track. Imagine an ambulance, right?
Mm-mm.
But it's equipped with a CT scanner and a whole team of stroke specialists. That's a mobile stroke unit.
Wow, so they're basically bringing the hospital to the patient. That's incredible.
It's a game changer, really.
Yeah.
Faster diagnosis, sometimes even before they reach the hospital. And immediate administration of those clot-busting medications, like alteplase. Remember, time is brain.
Right, right. Those medications, they only work within a certain time frame, so faster diagnosis equals a better chance of recovery. Makes sense. Speaking of alteplase, the seminar mentioned the time window for giving it. It's been expanded, and there's even a new drug in the mix, tenecteplase. What's the deal with that one?
You're really on top of this stuff. So tenecteplase,
Hmm.
it's a big deal because it can be given as a single injection, faster, more practical, especially in those, critical early moments.
So faster treatment, potentially even before reaching the hospital. That's a huge win for ischemic stroke patients. But what about those cases where medication just, like, isn't enough? Is it game over then?
Yep. Not at all. That's where endovascular thrombectomy comes in.
Okay, yeah, I've heard whispers about this procedure. Sounds pretty intense. Break it down for me.
It sounds more intimidating than it actually is, although, yeah, it's definitely cutting-edge stuff. Basically, doctors insert a catheter, right, through a blood vessel in the groin, and they guide it all the way up, all the way to the blocked artery in the brain. Once they're there, they use this tiny little device to actually remove the clot, restores blood flow.
Whoa, talk about minimally invasive. So they're literally like fishing out the clot from the brain. That's incredible.
It really is remarkable. And the Lancet seminar, it highlights just how effective this procedure has become, even for large clots or blockages in those, crucial arteries.
So even in what might seem like impossible cases, there's still hope. That's good to know.
It is. And on the hemorrhagic stroke front, while the advancements, they may not seem as, dramatic, there's been a real emphasis on this comprehensive approach. They call it bundled care.
Bundled care, interesting. What does that entail?
Think of it like a well-coordinated symphony of interventions, all aimed at minimizing brain damage, improving outcomes, rapidly reversing any blood thinners the patient might be on, meticulously managing blood pressure, ensuring they receive specialized care in a dedicated stroke unit. It's all connected.
It's like this well-oiled machine, right? Making sure all the critical parts are working together seamlessly. This bundled care approach, it seems like a step in the right direction, especially for, hemorrhagic stroke. And speaking of specialized care, the seminar really, really hammered home the importance of stroke units.
Yeah, they did. Stroke units, they're these incredible dedicated units within hospitals, specifically staffed with like a multidisciplinary team. Stroke specialists, doctors, nurses, therapists, all focused on, providing the best possible stroke care.
So it's kind of like a brain healing haven, a place where everyone's on the same page when it comes to stroke recovery.
That's a great way to put it.
Yep.
And studies have shown stroke patients treated in these specialized units, they have much better outcomes compared to, those treated in general wards.
Yeah.
And it makes sense, right? Because stroke units, they're equipped to handle those unique challenges that come with stroke, swallowing issues, mobility problems, even implementing those targeted secondary prevention strategies.
Right, all super important aspects of, bouncing back from a stroke. Now, let's talk about secondary prevention for a minute,
Hmm.
because the seminar really stressed how crucial it is. It's not just about surviving the stroke, it's about preventing another one, yeah.
100%. Once you've had one stroke, your risk of having another one, it goes way up.
Yeah.
So, yeah, secondary prevention, it's a lifelong commitment, not just a temporary thing.
Okay, so what does that look like? What can someone actually do to, minimize their risk after having a stroke?
Well, it starts with those lifestyle changes, the ones we hear about all the time. A
Mhm.
heart-healthy diet, regular exercise, and if you're a smoker, quitting is an absolute must. And then, of course, there are medications. But those are often tailored to the specific type of stroke and, that underlying cause we were talking about earlier.
So someone who's had say, a heart-related ischemic stroke, they'd probably be on blood thinners long term.
Right. Oral anticoagulants, those are typically recommended for patients with a history of cardioembolic stroke. So that's where the clot originated in the heart. And for the non-cardioembolic strokes, antiplatelet medications like, aspirin or clopidogrel, those are common, helps prevent future clots.
And then no matter the type of stroke, managing other risk factors like high blood pressure, diabetes, high cholesterol, that's all still super important, right?
Absolutely. Keeping those in check, it drastically reduces the risk of another stroke. And in some cases, you might see additional procedures recommended. A carotid endarterectomy, for example. That's to open up a narrowed neck artery. Or a patent form and oval closure. That's for a specific type of heart defect.
It's pretty incredible, honestly, all the different options out there now for stroke prevention. It seems like the main takeaway is work closely with your doctor, figure out a personalized prevention plan, right?
100%. Secondary prevention, it's not one size fits all. It's about really understanding an individual's risk factors, creating a plan that addresses those specific needs.
It's about understanding your own, risk map
Mhm.
and then, taking those proactive steps. Now, before we wrap up, I think it's important to mention the challenges of life after stroke. The seminar didn't shy away from those aspects, which I appreciate.
And rightfully so. Stroke, it can have lasting effects. Physical, cognitive, emotional. Many survivors deal with ongoing challenges, memory issues, mood swings, just constant fatigue. It's not always easy.
No, definitely not. And those challenges, they can really impact someone's quality of life. It goes way beyond just that initial event.
Absolutely. And while the seminar, it acknowledges that more research is needed in this area, it really highlights the value of comprehensive rehabilitation. Physical therapy, occupational therapy, speech therapy, even counseling. All these things can help people regain lost function, adapt to life after a stroke.
Yeah. It's a good reminder that stroke recovery, it's not just about those immediate physical effects. It's about, holistic care, support for the long term.
Exactly. It's about empowering stroke survivors,
Mhm.
helping them navigate those challenges and ultimately live their lives to the fullest.
Well said. This has been a truly eye-opening deep dive. The progress we've made in stroke treatment, it's remarkable, to say the least. And with all the research being done, new drug therapies, groundbreaking surgical techniques, the future of stroke treatment, it's looking bright.
It really is.
Yeah.
But as we've learned today, prevention. Still the most powerful tool we have. Knowing those signs and symptoms, understanding your own personal risk factors, and getting medical attention immediately when you need it, that can make all the difference.
Couldn't agree more. So to everyone listening, here's a little food for thought. What's one small step you can take today to reduce your risk of stroke? Maybe it's scheduling that doctor's appointment you've been putting off, getting your blood pressure checked, or just, I don't know, finally making your health a priority. Whatever it is, take that step. Your brain will thank you.